The other thing about alcohol and some of these other drugs is that, you've got alcohol on board in your system, and then let's say you decide you're going to kill yourself and you're going to overdose on something. Well, the alcohol can add to the problem, right? So your alcohol depresses the brain's activity, suppresses it so far, makes your depression worse, but it also can, if you drink enough, you won't breathe, obviously. So you shut the brain down a little bit with the alcohol. Then you overdose on something like Xanax or something that has the same effect, and there's a higher likelihood now of dying than there was when if you just would have overdosed on the medication like Valium or whatever else. That's a lot of risk factors, and so in a way to try to remember this a little bit easier, I've come across this little mnemonic. It doesn't have everything that I just mentioned in it, but it's pretty good. I thought it was pretty good. And it's is path warm. I don't know that it really makes a lot of sense, but it does. Sometimes if you put things into a sentence or a sentence like this, it's a little bit easier to remember them. So let's go through these real quick. I kind of highlighted the first letter of each of these words. So the I is for ideation, and this is suicidal ideation, obviously. So these are folks who talk about death, dying, or suicide. They look for ways to kill themselves. They even threaten to or talk about wanting to kill themselves. Substance abuse is just what we just talked about. Purposelessness. These are folks, obviously, they don't have any purpose or reason to live, any purpose in life. The A is for anxiety, and these folks, they can get anxious, they can get agitated, they have trouble sleeping. So again, if you start seeing all these things in a person, you don't have to see all of them, but if you see several of these in a person, and that's something to kind of worry about, a little bit to worry about. Finally, the T is for trapped, and this is where they feel like they're trapped, there's no way out. H is for hopelessness, which is what it says. Withdrawal, so this is social withdrawal, away from other people or contacts. That's always a little bit of a warning sign. A is for anger, and these folks can have uncontrolled rage. It's makes them very impulsive, very likely to act out on things that are upsetting them. Recklessness, and they engage. It's a person who might engage in some activity without really thinking about the consequence of it. I don't know, driving down the road really, really super fast, and just not wearing a seatbelt, not really caring if they live or die. And then dramatic mood changes is the M. So those are the risk factors for suicide. And so we've talked up to this point about completed suicide. What about the risk factors for somebody killing themselves? What I think we should talk just for a moment about is what we call suicidality now. Suicidality it has various definitions. What I like to think of suicidality as is where somebody will have thoughts of killing themselves, or they'll attempt suicide, but they don't die. But the intent is to kill themselves. Okay, so again, the idea is it's the intent. It's what do you want to do when you're hurting yourself? Do you want to die? Because there are a lot of people who hurt themselves, but they don't necessarily want to die. So are they suicidal? Not really. I mean, if they carve superficially cut their boyfriend's initials in their arm, they probably are smart enough to know that's not going to kill them. And they're probably doing that for some other reason besides trying to kill themselves. Okay. So you have to sort that out, and sometimes that can be kind of difficult. I guess you might think to yourself, what the heck why would somebody cut on themselves? Why would they hurt themselves if it wasn't for suicide? There's a whole lot of reasons for that, and in my experience, I can tell you kind of what I've seen and what I've had patients tell me. The cutting or the hurting, it doesn't have to be cutting. It can be sometimes folks will burn themselves with a cigarette. Sometimes they'll hit themselves. Sometimes they'll bang their head. There's a bunch of different ways to do things to hurt yourself. But why? The answer, it varies. You have to ask each patient, each person. But some people feel sort of emotionally numb, and so by causing themselves physical pain, it sort of wakes them up, so to speak, I've heard somebody say that before. I've also heard people say that they don't feel real, and there's and I don't know, some of us may not have experienced that before, but you know, it's called derealization. It's where you feel like things around you are a movie. It's not real, and you're not real, and nothing around you is real. So sometimes they'll cut, and when they see the blood, then they think, you know, it's like a realization that, okay, I am real. I felt that. I see the blood. It somehow sends a message that they're real. That sounds bizarre, but that is something that I've seen before. Some people do it to punish themselves. It also sounds a little bizarre to a lot of folks, I think, but I can see, these are folks that a lot of times they've been abused, they've been beat on, they've been cut by their parents or hurt by their parents really badly, and then they do something as an adult or a young adult that they think is really wrong or that they've screwed up in some way, and they feel like, well, I need to be punished, and they cut on themselves. So there's all these reasons, and I think the key is if you have somebody who's doing something like that, you want to seek professional help. I mean, don't try to figure it out yourself, because it's very hard to figure out. Even for the professionals, it's hard to figure out. But if you try to figure out yourself, you may be wrong, and this person may end up killing themselves. So you got to be very careful with this stuff. I think sometimes I've seen where family members will sort of blow off the early signs that somebody's suicidal. Some of this stuff, they'll blow it off and not get the person any help because they think it's just a behavioral issue or a tantrum or something that they're throwing. But I don't think that's very wise, because it's a sign that there's something wrong regardless. Whether or not they're suicidal or not, it's a sign that something's wrong. The other thing that's a problem is sometimes, that's hard to figure out with suicidality, is sometimes people won't realize that what they're going to do to, let's give an example. A boyfriend, girlfriend are fighting. The boyfriend wants to break up with the girlfriend. She says, no, I can't live without you. And she takes 5 or 6 Tylenol in front of him. Okay? Now, she's right in front of him, so you kind of have the feeling that she knows that he's going to get her treatment, and so she probably doesn't really mean to die. She probably is trying to send a message to him or draw him out, draw him closer so that he can be the rescuer and protector. I've seen that very often in the hospital. But sometimes what will happen is the person will do something that they think is safe, So instead of 5 or 6 Tylenol, they think, well, Tylenol's over the counter, I'll just take the whole bottle. And they take 30 or 40 of them, okay? Unfortunately, Tylenol can kill you, So they do that, and it's again, do you call it a suicide attempt? I don't know. That's you have to take each case individually, but probably the intent was not to die. It sort of depends. You'd have to ask that patient and just look at the whole situation. The intent, the case I gave you earlier, the intent was probably obviously to die. I mean, she did it in the middle of nowhere. If she wanted somebody to find her and she really didn't want to die, she wouldn't have done it in the middle of nowhere. So she had the intent all along, but she just was not. She would not let anybody in. Would not tell anybody about it. So much so that she pulled the wool over the eyes of the treaters, the professionals, got out of the hospital and did it. So, again, seek the professional help. And I'm going to go into for a minute what you should do if you suspect that somebody's suicidal. As a matter of fact, we may as well just go into that now. So you suspect that a family member or a friend is suicidal. Okay, the first thing you want to do is anything that's like of very high risk right around the person, let's get rid of that. So knives and medicines or anything they may use at the spur of the moment right now to hurt themselves, let's get rid of. Second thing is engage the person. Try to talk to them about how they're feeling and what's going on. You don't necessarily need to be their counselor or anything like that, but you do need to be non-judgmental. If they say, I'm feeling depressed, I got to admit to you, I just don't care if I live anymore, You can't go, oh my gosh, and freak out on them. You can't do that. You have to be non-judgmental, and you can't, be, shocked and all this stuff. You have to kind of maintain a level head and talk through it with them. You don't want to swear to secrecy because you can't keep that promise. So if they say, I don't care if I live anymore. As a matter of fact, I've really been thinking everybody else would be better off without me, and I bought this gun the other day, and I'm really thinking about killing myself. But I don't want you to tell anybody. You can't tell anybody. I don't care if you're their best friend in the world. That just doesn't make sense, right? You got to say something to somebody because that person's going to end up dead, right? So do you break the confidence and let them survive or hopefully get them help? And that's the decision. That's what you do. Because they're influenced probably by depression or something that's making them not think rationally. So don't swear to secrecy